What's up, Nutrition Heroes? This is Dr. Brad, and you are listening to the Nutrition Hero Podcast once again. Welcome to the next episode. Today, I have some interesting things for you, and what I decided to do, instead of publishing an interview today, and I have a couple in the hopper, what I wanted to do is go through and answer on a podcast some of the questions that I received during the week from listeners. And so I just picked a handful of them here, but you could submit questions to me. We'll go through them on a podcast. I think I'm going to make this a regular thing. And I kind of like it. I think it'd be fun. But Brad at biogenetics.com, you can submit your questions. And Brad at biogenetics.com. So these are a few that I got this week that I thought were good questions. And instead of just answering them back to the doctor or the person that requested, I think I'm just going to put it on the airwaves here so that everybody can get this information, because I'm sure if one person has the question, somebody else is going to as well. Anyway, it's one of the things that I have made a habit of, is asking questions over the years, especially if I find somebody that's been in the functional medicine game longer than me, or somebody that has a different area of expertise than I do. And I enjoy it. I have this thing I call the $1 Million Notebook, and I've had the same notebook for almost a decade. But I jot down questions and answers and who told me about it, that type of stuff. I create a paper trail that I appreciate, and I can go back and review and look at. And be surprised at some of the stuff that you learn and then you forget, and then you learn it again as you do the review. And so I want you to start your $1 Million Notebook, and it's going to come in handy at some point, especially in functional medicine, since the database of information is always growing. This is something that you can begin to formulate. It's something that nobody else is going to do for you, and it's pretty sweet. So with that in mind, I picked 4 or 5 questions here. We'll see how many we get through in about 30-35 minutes, and see how it goes. So, all right, Brad at biogenetics.com. Send me your questions, and it could be mechanistic stuff. It could be about the art of functional medicine, whatever you prefer. So I'm open to anything. I'm an open book. All right. So here's a question. How do I get people into my practice? This has come from a doctor out on the West Coast. And I want to talk about this specifically because there are a lot of ways where you can get people into your clinic from a functional medicine perspective, but only a few that I think are valuable. And so one of the things that I like to start with is this. How do you keep people out of your clinic? Right? How do you do that? How do you keep them away from your business in the first place? And if you can figure out that, if you can figure out how you're keeping people out of your clinic, well, do the opposite of that. Do the opposite. So if you think about it, if somebody wants more people in their practice to begin with, you would ask the question, what are we currently doing that is not allowing them to show up? And so typically what I find is that people keep their information to themselves. They think, I'm not going to tell people my information because then they won't pay for it. And that's not the case. So people are willing to pay where they find value. And when they find value, typically you have to create value. And in just my opinion, the information's out there. Anybody can learn anything in 2017. Anybody can learn anything with the internet the way that it is today. And it's about creating that value in relationship, and that's typically what people are going to end up staying in your clinic for. So, all right. So with that in mind, take an inventory. What are you doing right now that's keeping people out of your clinic? And if you're keeping silent, if you're not getting your message out there, if you're not building a tribe of people that you're investing into their life, right, there's not going to be any exchange, and they could care less about you. So if you want them to care about your message, and if you want them to care about what you're doing, then you have to sit down and actually think about, would I pay for my services? Would I pay for my services? Would I actually do it? Would I actually exchange time and energy and resource for the service that I'm providing somebody right now? And if you say no, if you actually have just even a hint of saying no, then you really got to look at that and create a better patient experience. And so referrals, I like referrals. I think those are the best way to grow a practice. just my opinion, because those patients have already been, the patients that come off of a referral they already know the drill, so to speak. They've heard a story, they've heard a patient story, they've seen patient results or a patient experience, and there it is. We get better continuity, I would say, with care off of a referral, and as long as you're treating those people with respect, there's no reason why they won't refer people your way in the future. And so that can take a little while to get rolling, but if you have a current practice, let's say, of patients and they're not functional medicine patients, maybe you're a chiropractor, or maybe you're a health coach doing more like dietary counseling, that type of stuff. One of the things that you can do is rebuild your patient experience and sit down. There are some cool podcasts out there on this type of a thing, but you can rebuild your patient experience and just reinvest in the people that you're already serving. Reinvest in them, give them an opportunity to participate in your practice a little differently, and that's pretty cool. So yes, I'm a chiropractor, and yes, my wife is a chiropractor, but I go to see another chiropractor just because of the experience of being in the clinic, just because of the experience that they've created, and it's cool. So something to think about there. A rule of thumb that I have found over the years, this is not my information, this is information that I've learned from coaches and consultants over the years, and it's do not advertise broadly. Don't advertise broadly. No shotgun approach with advertising in the functional medicine space. If you can pick a niche, if you can pick a group of people and say, how do I serve these people? What do I have to do in order to meet them where they're at? That if you're going to advertise, that's the way to do it, is making sure that you pick a niche. If you want more information on this type of a topic, there are people that are absolutely better voices in the marketing arena, absolutely better voices in the business coaching arena than I am. And I can point you in their direction if you'd like more information on that. There's a smattering of different coaches and consultants that I've been able to glean information from over the years. It's pretty sweet. So, all right. So enough of that one. Enough of that. Insulin. What's up with insulin, and do you have any information for me on that? That was the question. I think what we can talk about here with insulin is, if we can get a little clinical on this episode of Question and Answer. Insulin. One of the things, we'll just start with diabetes. How about that? So one of the things that I find with insulin and diabetes is that in a doctor's mind, in a traditional medical setting, insulin is the problem. And one of the things that we see in the functional medicine realm, and really in the clinical literature, the research, is that insulin is usually not the problem. Insulin's usually not the problem. It's usually a receptor site in somebody that has type 2 diabetes where we have insulin resistance. And the question is does that insulin resistance serve a purpose? Is that insulin resistance there for a reason, and could it be protecting them from something? So some of the clinical literature that you're going to find out there right now is going to describe type 2 diabetes more of an inflammatory issue dealing with oxidative stress than insulin resistance itself, meaning the insulin resistance is a secondary problem. It's a result of the oxidative stress and the cell's ability to protect itself. And I'm going to be doing a seminar at the end of the month here in Baltimore, and we're going to talk a lot about this. We're going to talk a lot about this because this is something that in the next 10 years, if you understand this now in 2017, when 2025 rolls around, when 2027 rolls around, which sounds crazy to say, you're going to be ahead of the game because there's going to be medications that are addressing all of these things that we're talking about. And if you're going to do it with food and nutritional approaches, more power to you. So anyway, oxidative stress is going to be the killer of more people with type 2 diabetes than insulin resistance. And you can call it insulin resistance, but that's the result. It absolutely is the result. So if we want to talk about insulin here, in type 2 diabetes, mainline therapy, insulin tends to be the end of the road. Like when your patient ends up with high blood sugar, they go to the doctor's like, hey, You have type 2 diabetes. It's genetic. You need to diet, lose weight, and exercise. There's nothing you can do about it. Have a good day. Take these medications, so they get put on metformin, usually 500 milligrams, maybe 1,000 if the doctor's feeling aggressive for the day. And what happens is the patient goes back home. They get a letter in the mail that says, hey, it's time for you to meet with your diabetes educator. So they're like a little freaked out, right? Because, well, they just got diagnosed. They just got stamped on the forehead with type 2 diabetes diagnosis. And so what happens is they are like, I'm going to this visit with the nutritional educator. And they do. And it's cool. Like, they learn how to count their carbs, and which is a good skill to have, right? They learn how to make a colorful plate following the My Plate recommendations that the government puts out, and have your vegetables and your fruits and all your stuff and plastic food on those plates, and here's how you do it. Here's what you should learn. You're going to do a great job. Take your pills. Come back and see me in 6 months. So the patient gets out there. They do it. They think they're doing a good job, and they're hammering away. They're just getting it taken care of. And what happens is they come back in 6 months, and the doctor flips open the chart, and they go, I apologize that I have to tell you this, Mr. Smith, but your A1C is still not in control. Your A1C is still not in a good diabetes range. Like, there's a good diabetes range, right? And so we're going to have to increase your medication. And so they do it, and they just go through this over and over again, time and time again. And the problem that you see with it is that it always ends up with, well, we're going to have to move you to insulin. Like, that's the solution, because in the doctor's mind, the whole stinking time, they're thinking that this patient's not producing enough insulin, right? And that's a stressful position for a patient to be in. But even for the medical doctor, or the primary doctor that's dealing with the insulin usage, that's stressful for them to be in that situation. What do they want with giving a patient insulin? They don't want to do that. It doesn't make them feel any better when they're like, well, there's nothing we can do except replace function, when that replacing function is what the body is fighting in the first place. So when we talk about insulin in a diabetes situation, it's not what you think. And the medical literature is pretty clear. It's not what you think. So when we are looking at insulin therapy as first line, or even like last line of defense for people that have type 2 diabetes, it's not what you think. And it's causing a lot of problems right now. So I'm maybe not exactly what you're looking for an answer, doctor, if you're watching this, but I'm telling you, you got to make sure you bone up on your insulin skills so that you understand the difference between running fasting insulin and C-peptide, so that you understand the difference between looking at 1,5-anhydroglucitol versus looking at an A1C score, so that you know what changes an A1C score, so that your blood sugar might be normal, but your A1C is higher because your red blood cells are living too long, right? What causes your red blood cells to live longer? Diet and exercise, right? So genetics. And these are things that if you're doing what you're supposed to and your A1C is too high, but your blood sugar value itself, your fasting sugars are normal, doctor's going to put you on medication for that A1C, because they're not looking at the mechanism, they're looking at the number. So, all right, I'll get off that soapbox there, because I could talk all day about that one. All right. Oh, here's a good one. How do you talk to a patient about a doctor that is clearly messing them up? I've had a lot of experience with this. You're in functional medicine for long enough, you're going to come across it. And the way that I would suggest is with the G word, grace. Have some grace for the situation, because you got to understand that doctor that's clearly messing up the patient, they're not intending to mess up the patient. They're just doing what the book tells them. And because that's their job. They got to follow the book. They got to follow the action plan. So have some grace. Never lob bombs. Never say anything bad about another doctor, personally. Okay? Don't do that. It'll always come back to bite you in the tail. And so if you can craft your message to the patient to be in a way that is not self-serving, that would be the idea. Okay? Because really, at the end of the day, it's about the patient. So just remember to have grace in that one of the things that I found to be the most helpful is to start out by saying, that doctor, I have a couple of patients that doctor works on. Obviously, if that's the case, do that. And I find that they're a really good doctor. Start out there. However, in this instance, I feel like fill in the blank, whatever the issue is happening, okay? And then close by saying, and remember, they're a really good doctor. They have your best interests in mind. It's just in this instance, I think there needs to be some different consultation that happens, or whatever it is. But use grace, use tact, and remember that if you want that patient to come back to you, right, it's because they're going to respect you, right? Any doctor can lob bombs at another doctor or another clinic and be like, yeah, they're an idiot. Any doctor can do that, right? And guess what? That patient's going to go to somebody else's clinic, and that doctor's going to do that to you. And when you are willing to stand apart from that and not participate in that style of communication, this makes a huge difference. So have some honor, I guess is what I'm saying. Grace and honor is what you would want to do. So honor the other doctor, right? Especially if it's somebody that's your senior. And let's say they're 65 years old and they've been a doctor since they were 30. Look what they're doing for their community. They're laying it down for 35 years to serve their community with the mindset of, I'm going to make people's lives better. And even though the way that they do it might be a little interesting sometimes and might be a little convoluted and not necessarily what medical literature is explicitly laying out, I think that if you can honor their decision to serve their community, it goes a long way. So, all right. And by the way, when you talk to doctors of any type, it could be a dentist, chiropractor, physical therapist, medical doctor, DO, whatever, you want to make sure that when you talk with them on the phone regarding a patient or you have conversation, etc., they're used to, when they get a phone call from another provider, what happens typically? They get their defense goes up. They go, what does this guy want? Right? What's he going to tell me that I'm doing wrong? And then I'm going to have to defend myself, okay? So don't do that. You can break all that away by just showing them some honor right out of the gate. So, pretty cool. All right. Fight or flight versus parasympathetic activation. Any tips, any tricks to helping people overcome fight or flight? So what they're talking about is sympathetic nervous system activation versus parasympathetic nervous system activation. And if you're living in the United States today, especially if you're watching the news this week with all this hurricane and like craziness, you're getting some sympathetic overdrive patients. And I met one yesterday. How's your day going? Horrible. Why? Because I'm so stressed out and worrying about this hurricane that's coming towards Miami, Florida. Okay, we're in Minnesota right now. Yeah, but it's stressing me out. How come? And just sit and listen, right? And what's happening is if it wasn't that hurricane, then it's going to be something else. It's going to be the president. And if it's not the president, then it's going to be, the way the Attorney General of the United States is handling something. If it's not them, it's going to be fill in the blank. So if there's if 50% of people's consciousness, and it's probably more, is focusing on worry, if they get rid of one worry, something else is going to fill that void. It always does. So the point is that their nervous system is inclined to be in that sympathetic overdrive at a consistent level right now, and you kind of want that to go away, right? So if you're going to get any level of healing, especially if they have metabolic disease or autoimmune conditions, you want that to chill the heck out. And one of the ways to do that, I find, is through breathing. And I'm not talking about like yoga or meditation or anything like that. Literally, I'm talking about teaching your patients how to breathe again. There's some medical literature out there that I think is pretty cool about breathing diaphragmatic breaths, right? If I can just maybe I made that word up, but breathing with the diaphragm rather than breathing with your chest, right? So we're talking about belly breath rather than chest breath. And so one of the things that you do is actually place your hand on your belly, and as you breathe in, you want to breathe down and out rather than up and in. So down and out is the key. If you can do that consistently, I can't remember if the medical article that I read, should write that, is talking about 20 minutes, or I can't remember if it was 20 minutes or 20 minutes like 3 times a week, where if you can focus on your belly breath, if somebody's just sitting at their desk at the office, focus on your belly breath, what's happening is you're stimulating your autonomic nervous system in a way that it's not going to get stimulated otherwise, especially if they're watching the news, or especially if they have family members that they're spending life with, any of that stuff. How to put them into parasympathetic stimulation rather than that sympathetic overdrive. Think about it. Every single time that your lungs expand, especially like your thoracic cage expands, you're activating that sympathetic nervous system every single time. And so if you can do the rest and digest breathing skill, it's focusing on that. Even if you can get somebody to do 20 breaths right away, sitting in front of you in your office, get them to do 20 breaths. You're going to find a difference. You're going to see people change. Their nervous system is going to change. They're going to go from like this wired situation where they can't stop blinking. Okay, that's one of the ways that you can tell sympathetic overdrive. They can't stop blinking and they're always just going at it. Like how confusing or how distracting is that, right? When you're listening to somebody, if I was here just blinking the whole time, you're not going to listen to a word I'm saying, right? But when you can transition them from that blinking stage into a spot where they are chilled out and they can focus on activating that parasympathetic nervous system, you'll see it, right? You'll see it in their demeanor. They'll go, I think I need a nap. And really what's happening is we're just getting that fight or flight mode to shut off, even for 10 minutes is a big deal. And you can coach your patients on that. In fact, it's kind of if you're into putting out information, by the way, for your patients, like this is a way, maybe this answers question 1, how do I get people into my practice? Content, right? Do what I'm doing here. Put together some video clips of yourself, okay, and hand them out to your patients. You can email them to your patients, create a link, have at it. But give them some breathing tips. So how to activate the rest and digest instead of the fight or flight. It's a pretty big deal. And you'll see it. You can do that with yourself, by the way, as well. And most of the time your patients aren't going to do something unless you do it yourself. So if you can train yourself to do that first, rest and digest and activate that on a daily basis, it's going to go a long way. So, all right. What else do we got here? A couple of other questions that maybe we'll find some value in. How about this one? Doctor, how much attention are you spending on somebody before you refer them to another doctor? That's a good question. So, this is just my opinion, and this is my personality. Sometimes my patients call me Dr. Hope. And they call me Dr. Hope because I'm never going to agree with them that they're a lost cause. Never. I'm not going to do it. And maybe that's to my own detriment sometimes, but if I'm going to be Dr. Hope, what does that mean? It means that I'm going to spend attention on them until they either die of old age, right? Or they're in a spot where they're not following through. I guess I should put that as a caveat. I'll spend attention on them until we figure out the issue or they die of old age, as long as they're doing their part. If I care more about their outcome than they do, then I'm not going to do that at all. No way. I'm not going to spend attention on that, right? But if they're in and they care about their situation, obviously, I'm gonna spend attention on that with them. And so I have patients that I've been treating for 8 years. And, it's one of those things where their health is an ebb and a flow. They have good times where I won't hear from them for maybe 6 or 7 months. And then it's like, hey, hit a rough patch, need your help. Okay? And that's just my mentality, is making sure that you spend attention on people that need it, number one. But number two, people that are worthy of attention being spent on them. Now, this kind of goes to a different angle on that topic, but you got to know pick and choose your battles, right? Like, pick and choose your battles. Only fight battles where the spoils are worth it. And I mean that in a way like, for instance, there's a lady that I've been treating for a couple of years now, and she had mercury poisoning, like awful. And it took away a decade of her life. Her 40s, she basically missed. And she was at every doctor in the state of Minnesota that she could find. Even the large clinic in Minnesota that shall remain nameless, they basically told her, here's some muscle relaxants and here's some antidepressants, and it is what it is, right? And so she has insomnia. She had some numbness and tingling in the hands and feet, fatigue. She'd sleep in bed all day, like just can't do anything. She wouldn't leave the house for months at a time. That's crazy. Months at a time. Like I'm in my 30s and I think about, what if you didn't leave your house for 5 days at a time? That would be crazy, okay? But this lady, for months at a time, she'd have her groceries brought into her. She wouldn't go anywhere. She couldn't handle it. And so in that type of a situation, you help somebody like that, that's going to change their life. It's not going to just make them have a better day, like take a little pain away. It's going to change their life. And so in that type of a situation, the spoils are great, right? Like, the spoils are great. What you're fighting for is that lady's livelihood. You're fighting for her life. You're fighting for her to be able to have attention to spend with her husband again and with her kids. And, Lord willing, she has grandkids someday and gets to experience that, rather than being like the lady that feels like an old lady, even though she's not, and has to sit in the recliner and just look at everybody because she can't participate. And the spoils are great in that, and that's something that I'm willing to fight for. Like, I can get behind that. You know what I'm saying? And so that's what I'm talking about. Pick and choose your battles. If there's somebody that's like, I gotta watch my words here, right? But if you got somebody that is like, hey, I have this elbow pain that won't go away, and you're staying up till midnight trying to figure out what's going on with their elbow, right? And they don't really care. It's just like an annoying little injury that they have. That's not a battle that you're going to spend your nights fighting for, okay? It's not a battle that you're going to do that with. And so pick and choose your battles is what I'm saying. So that's how I know how long to keep somebody around is, do I care more about their health than they do? And number two, if you can attract a clinic full of people that care about their health and they're willing to fight for it with you, you're going to have projects to work on. So, and you got to be willing to do the work. You got to be willing to dig in and search things out. Use PubMed. You got to be willing to use resources that you have, right? Email me. You got to have the capacity to dig in on those resources and actually win some battles for your patients, okay? Win it for them, win it with them, however you want to think about it. But what's cool is that when it happens, the spoils are great. What's cool is that when it happens, it gives you, it's something that you can't buy, right? It's something like, you can't buy a 46-year-old lady getting her life back. You can't buy it, okay? And when it happens, it's cool. Like, it'll put a tear in your eye and give you goosebumps. I just got goosebumps yesterday, and that's a way that I measure, right? Is this real or is this not real? I got goosebumps yesterday, a lady that her husband was in a car accident, and she was so thankful for her health. Motorcycle accident, by the way, excuse me. She is so thankful for her health, being in a place where it is now, that she can take care of him, that, like, she almost started to cry, and I was just like, oh, goodness. You, like, put goosebumps on your arms, and you can feel it, and you go, wow, that was a battle worth fighting. That helped give that lady something that who knows what it would have been like otherwise, okay? She can't take care of her husband if she has to take care of herself. If she's the patient, how is she supposed to help him? So just something to think about there. And, yeah, that's cool. So fight for those battles. All right, I think that's all I have for you here on the question and answer podcast episode of the Nutrition Hero. And as always, keep focusing on your art and your science. You're going to change somebody's life.